This week there's been a coroner's inquest into the death of a mother during a home birth in Manchester, and it's shaken so many of us, especially those of us who work in obstetrics. Now this case will be hugely traumatic, of course, for the grieving family and also the members of staff who were involved in this case who will be feeling this loss deeply. And I want to start by saying we do not have the details on this case, and I do not wish to make conclusions about what might have happened or why. But I do want to talk about what this means for home birth and also what can happen when someone chooses to birth outside of medical guidelines, potentially at home. Now this particular woman had experienced a traumatic first birth, and when she became pregnant again, she wanted something different. And that wish, it makes complete sense. Birth trauma can leave people feeling powerless and unheard, so it's totally understandable that you might want to regain control and create a more positive experience the next time. And I want to also be clear that home birth can be a safe and empowering option for many people, especially if you have got a straightforward pregnancy and you've got the right support in place for you. But the evidence that we've got that says that home birth is safe, like the birthplace study, it applies to low-risk pregnancies. So when we're talking about births that fall outside of national guidelines, for example, where they're having a high-risk pregnancy, the situation changes. It comes down to how we talk about risk, how we prepare someone. We have guidelines that exist to reduce risk. We gather decades of evidence from across different countries, we sit experts down together to draw conclusions from all the evidence, we put together a guideline that we put into action, and so choosing to birth outside of guidelines as an act, it's likely that that person has been influenced by other factors in their own life, like what may have happened in the birth of friends and family, what they might have seen or read on social media. And so making the choice to birth outside guidelines doesn't make someone reckless, but our job as professionals is to unpick how and why they think that going against the medical advice, the evidence that we've got and the guidelines would actually lead to a safer and a better outcome for them and their baby. The guidelines that we have exist not to take away choices from women, but to make sure that people understand the real level of risk that's involved. Because when a complication that may happen in birth is discussed, we might describe it as rare, and it can feel abstract, it can feel like you're just trying to be scary, it's not important, until it happens to you. And then once it happens, it's irreversible. And in this case, the coroner questioned why the hospital staff were reluctant to use the word death when warning her about the dangers of a home birth, which would underline the seriousness of the decision. But this part struck me. How do we have that conversation? How do you tell someone, if you choose to give birth this way, you could die, without it sounding coercive? You're trying to make them choose what you want them to do, or potentially just terrifying them more and making them want to avoid medical professionals. I don't have an answer. If this woman was told that her choice could mean that she was more likely to die in birth, I'm not sure that would have changed her choice. It may have reaffirmed her decision that medical professionals are not on her side. I think we need to go further on this and look at what was underlying this situation. We're seeing more and more women who wish to birth outside guidelines, and the NHS notes that this is your right. You can push for a particular birth you want, even if you understand it's not recommended, and we as professionals try to still support that. So here's what I hope that people take away from this. If you have experienced birth trauma, please know that you have options. You can have psychological support, you can make a trauma-informed birth plan. You might have been let down by the system before, but it doesn't mean that you've got to choose a completely different approach this time. A safe and positive birth doesn't mean going outside the system, but it does require that you should feel heard and supported within the system. So here's some questions that you could ask. Why is my pregnancy considered high risk for a home birth? What would reduce that risk? Is there specific monitoring, or do I have to be in a hospital setting? You can ask, how can my birth environment be optimised to reduce my sense of trauma? And if you ever feel like you're being dismissed, or you don't trust the advice that you're being given, ask to speak to a senior clinician. My heart goes out to this woman's family, everyone that was involved in her care. So, did I miss anything? Let me know what you read from this story.